Hello, my name is Stuart Johnson. I am the lead for the Evaluation and Learning Workstream for the Girls Education Fund Manager. I'm also an employee of Cambridge Education, which is part of the Mott MacDonald Group, as a Senior Education Advisor. The paper I'd like to present today is entitled Addressing the Challenges Faced by Marginalised Girls in Sub-Saharan Africa and South Asia During COVID-19, the GEC's Holistic Framework Approach. So how did the pandemic change the context? This will be familiar to us all, I'm sure, but to go through it quickly. In March 2020, when the pandemic was declared, it resulted in a massive disruption. All GEC activities were disrupted by the pandemic. In all 17 countries where the GEC operates, schools were closed and lockdowns were put in place. It's easy to forget with the passing months. But at the time, there was a lack of clarity about how long the school closures would go on for. Some national governments hoped it would go on for only a matter of days or weeks, which has not panned out in most countries. There was also very little information about what alternative education provision would be put in place, if there were any plans in place at all. We know that the lockdown restrictions impacted immediately, particularly the poorest families, in terms of their livelihoods, causing food insecurity and reducing access to essential services, among other issues. It also heightened the vulnerability of girls to sexual exploitation, early marriage, domestic violence, and other safeguarding issues. So what happened immediately in the GEC? All GEC projects initially paused their delivery activities, but very quickly after that, with guidance from the fund manager, projects rapidly put in place activities to continue to provide support for girls. Previous humanitarian crises suggested that girls' safety and well-being was likely to be compromised if projects didn't effectively keep in touch with them. And so, the approach that was agreed with the department was that the initial activities should be focused on girls' safety and well-being, and not on their learning, for example. Projects' response plans were also informed by national response strategies as far as possible. And there was recognition that the most marginalised were the least likely to benefit from standard COVID responses implemented by the state. The graph here shows in outline the number of activities delivered by projects by different types. To highlight a few things, we see that 37 out of the 39 projects put in place activities to keep in touch with girls to monitor well-being and safety. 36 projects provided messaging around COVID and also distributed sanitary and hygiene items, while 36 projects, even at that initial stage, put in place distance learning activities. Most projects work to coordinate with national pandemic responses in working with the ministry and education clusters. 23 projects reported reaching at least 2/3 of the cohort girls in that initial 3-month period, whether it was by phone, radio, or digital means. But often, interestingly, the most effective mechanism was through established community-based support networks that were already in place before the pandemic. What was also found in that initial period by some projects was too great a reliance on mobile phones and the internet, because the girls and communities, many of them did not have access to those devices or to the internet, or the cost of data was too high. It was also found, unsurprisingly, that lockdowns and social distancing measures were hindering some projects' efforts to reach their clients. So that was the initial response plans. In the early months, many projects went out of the way to carry out rapid assessments to better understand the impact of the pandemic on the girls and the communities. Thereafter, 35 projects, those that were continuing into 2021, created medium-term response plans. These started between July and October last year. The focus of those plans, compared with the initial response plans, was broadened to ensure support for all GEC beneficiaries. And in terms of participating safely in learning, as well as tackling new challenges that were arising from the protracted nature of the pandemic. To support the development of those plans, the GEC Fund Manager created a framework which had 5 domains to help structure the plans. And this is the framework here. It is a 5-fold framework. The first domain was the continuation of teaching and learning. The second was on well-being and resilience. The third was social protection and safety. The fourth was influencing society and institutions. And the fifth domain was about returning to school or to learning centres. We can see from the graph here an indication of the number of project activities across the GEC by those 5 domains. What we see there is that domain 1 had the most activities, that is the continuation of teaching and learning. But interestingly, the graph also splits the activities in terms of those that were existing activities pre-pandemic, those that were adaptations of existing activities, and those that were completely new. What we see is that just over a third, 37%, were existing and unchanged activities. 43% were adapted, but only 20% were entirely new. If we focus on the new activities, the domain which had the greatest proportion of new activities was domain number 5, which is about returning to school. So that was the area where most innovation was needed, or new activities were needed to ensure that girls were able to go back to school. The forms of new activities that were most common were distance learning activities, supporting schools to reopen, COVID-19 health and hygiene messaging and distribution, campaigns around enrolment and returning to school, the creation and distribution of learning resources and curriculum development. In terms of activities that were adapted commonly, these were working with the Ministry of the Government or the government. So what we're saying there is that the projects were often working with the ministries and the government before, but they often changed or intensified their work during the pandemic. Other commonly adapted activities were around research and learning, supporting girls' transition to livelihoods and also disability inclusion. Those were some of the areas that there was the greatest level of adaptation or common activities requiring adaptation. So, more concretely, compared with the initial response plans, the medium-term response plan activities were more aligned with project's original pre-COVID interventions, albeit via remote or socially distanced modalities. The adaptations compared with the initial response plans included reaching girls who don't have access to phones or the internet, which was a learning, as I said, from the initial phase, and also meeting girls' psychosocial needs, which was an area for which there was evidence of increasing need as the weeks of the pandemic turned into months. Projects have strengthened and extended national COVID-19 responses to reach the most marginalised. And interestingly, in some cases, projects are reflecting that they are now able to reach the most marginalised more effectively than even before the pandemic, which is an interesting legacy of the pandemic to reflect on. A real focus has been on building teacher capacity to support beneficiaries to self-study and to better address learning and psychosocial needs. So that has been a real focus for many projects, working with teachers and building their capacity to support girls even when schools are closed. Another common area for projects has been the provision of safe learning spaces for small groups of girls. Another focus was providing self-study materials. Involving parents, siblings and community members to encourage and support girls' learning has been another common area under the medium-term response plans. And so too has been creating clear pathways back into school or other structured learning group opportunities. I want to highlight 3 trends which we have noticed across the project's responses. The first trend is about projects' ability to adapt. It's the case that all projects have adapted and adapted well to the COVID-19 context and found ways to support girls while schools are being closed. But what we have found is that those organisations that are more accustomed and have in place mechanisms and processes for adaptive management, particularly with data feedback loops, and also those with community-based networks in place, those were the projects most able to adapt in a timely way. The second trend, which is linked to the previous one, is the role of community structures and volunteers. Those community-based structures and volunteers have proved to be the most important part of the system for keeping in touch with girls, also for supporting their well-being and safety, for keeping girls engaged in learning, and for supporting girls to return to school. This is an area that we are increasingly recognising, and we want to draw out more learning from this. So watch this space for future learning pieces from the GEC on this area. The third trend I want to highlight is around the opportunity that COVID has created for strengthening the role that the projects have nationally. It has created opportunities for strengthening projects' interactions with national governments as they have contributed to national COVID initiatives. There are a few examples here, which I won't go through now for time's sake. So finally, what next? Across the 17 countries in which the GEC operates, the degree of the impact that COVID has had on learning, safety, well-being and returning to school has varied quite considerably by context. But what is common across all countries is that the constraints to girls' access to quality education has been exacerbated by the pandemic. Right now, there is a range of contexts that exist in the countries in terms of school closures and reopening. Project's focus now is on continuing to support girls' safety and well-being, getting children back into school, and understanding and addressing the learning loss. There is a strategic goal now for learning from the innovations that have come from this period to be integrated into revised systems for building back better and not just to accept an automatic return to pre-pandemic norms. And the last point is that we have a learning strategy at the GEC now, and over the next 3 to 6 months, there will be a real focus of activity on capturing and disseminating learning from the GEC and the project's work from the past year on the theme of challenge, mitigation and resilience, the story so far of COVID-19 and the GEC. So as I said earlier, watch this space with the GEC for more learning on this theme over the next 6 months. Thank you very much.